The Dental Download Podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello everyone, happy Monday and welcome back to another episode. If I sound perky, it's because I am on break. So nice. I get a whole 1 week off between semesters of dental school. Actually, I guess it's years because I just finished my second year of dental school. I start my third year the first week of May, and that's what this episode is all about, actually. It's my semester recap. I do this every single semester of dental school, so you can go ahead and search them on whatever platform you're listening to, just Dental Download Podcast, D1 Summer, D1 Fall, D1 Winter, all the way up until now, which is my D2 Winter. So I'm going to go through highs and lows of different classes, things I liked, things I didn't like, things that stick out as just like exceptionally challenging or maybe exceptionally great. You know, it doesn't always have to be negative when it comes to school. And then we're also going to talk about how I've transitioned into different activities within my clubs. We're going to talk about my clinic experience, so it's all assisting at this point of D2. And then we're going to talk about just like life updates for the most part. So kind of like how my mental health is doing, social life, happiness, living arrangements, updates for all of that. And then we'll end off the episode with some predictions. I always do a YouTube video every school year called like assumptions for the next year. So I react to what I assumed about second year and then I make more predictions about third year. So I always think that's a fun video. That'll be up in a couple weeks on my YouTube channel, which is just Haley Schultz. And for now, though, we'll get right into this week's episode. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Okay, so first thing, like I said, we're going to talk about clinic. So what all did I get to do in clinic as my last semester of D2 year? I'm going to preface this with saying it still wasn't what we were told when we started dental school, unfortunately. There was still some restrictions because of COVID, because of limited clinic space, since they're just finishing the renovation currently, and like the third and fourth years being behind on their requirements, therefore we have to do less, unfortunately. So all we got to do was assist. Usually in your second year, you'd be doing same days. So you assist a fourth year and you both get the credits for the procedure, but you get to do it as the second year and they kind of guide you through like a simple filling or cleanings and things. But unfortunately, we didn't get to do that. And our first treatment on our own patients won't be until this coming May when we're officially third years. But we did have a ton of assisting, and I'm still really grateful for that. We had, I think, 15 required this semester, if I'm remembering correctly, in the general VIX was what we call it, just like the undergrad clinic where the third and fourth years see patients. Then we also had a few grad perio assists, and we will start rotations for all the other types of specialty programs during our third year as well. So really we just had exposure to the grad perio clinic and the undergrad clinic. And I really like assisting. I think I learn a lot, especially because we get to be a little bit picky, I guess, about like which procedures we want to assist. You can either just show up and assist whoever needs help, or you can kind of look at the schedule, look for people you like that are good teachers, like third and fourth year students that really know what they're doing or really like to explain as they go through it. Those are the kind of people I like to assist. And it breaks down to having to do like 1 or 2 per week, but sometimes I would even do 3. And again, I was really always looking at the schedule to see what types of procedures they were doing and what seemed interesting to me, what I wanted to learn more about. Maybe something we practiced in SimLab, but I wanted to see it done on a real person. So I would try to find procedures like that. That way I'm making the most of my assisting experience. And the reason sometimes I would do 3 is not because I was going to finish the semester with way more than we needed, but I try to get them done early. That way I can avoid assisting like the last couple weeks of the semester when we're busy with finals. So if you're allowed to work ahead at your program, I highly recommend it because that's really nice, just having one less thing to worry about when it comes time for finals. And speaking of finals, I'll do a quick recap of all the classes that we took this semester. So I have my transcript pulled up as always so I can go through for you all. We had 26.5 credits and it looks like 3 pass-fail classes. So those I all passed them, of course. You just basically have to meet the requirements of all the assignments and take the exams and pass and everything. So I passed those 3 classes, which was occlusion, advanced restorative dentistry, and dental profession and practice management. Then the other classes were all graded, and those were kind of a mix. I had 1 C+ in Principles of Restorative Dentistry, so a lecture class based on restorative principles, but I just thought the exams were a little wonky. And I mean, I got an A+ in Clinical Foundations, which is the class where you actually do the work. So I have to think that I know a little bit more than maybe those lecture quizzes gave me credit for, hopefully. And then most of my other classes were A's, A-, a few B's. So we had Principles of Oral Surgery. I wasn't the biggest fan of that class. I thought it wasn't structured very well. And I also don't have that much interest in surgery. So I was kind of a class. I just did the work and moved on. And then we had medically compromised patients, which I really, really appreciated because that was like one of the things that made me the most nervous about clinic, was knowing that I was going to be working with complex patients, especially some people that might be going to the school because it's lower cost. Maybe they don't have insurance, or maybe they do, but they're just tight on cash. Sometimes those people in lower socioeconomic status have more health issues. So I was just nervous that I would have patients with medications I wasn't familiar with, or just not being competent enough to have discussions with them about their treatment without having to run and ask my faculty. Like, I want to be knowledgeable enough to discuss their treatment options, to discuss the contraindications or reasons certain things may or may not work for their situation. And the medically compromised patient class just gave me a little bit more background in that. I still don't feel like 100% ready, but I feel like I have a little bit more resources around me now that I can reference when I know I have a patient coming in with a certain health condition. And then we had our assisting class, which is also pass-fail, and I met my requirements like I talked about in the beginning of this little segment here. And we also had our dentures class. So this semester we did RPDs, removable partial dentures, and last semester we did complete dentures. I'll talk about dentures a little bit later in this episode, but so tough. I liked this class better than last semester just because I connected with the professor a little bit better. I liked that her teaching style a little bit better personally, so I found this class to be more enjoyable, even though it was still challenging and debatably more challenging, just because there's so many different scenarios you could get when you have an RPD, that every framework is going to look different versus a complete denture. Other than like their ridge support and things, you're still giving them a full arch of teeth. So there's certain guidelines you meet every time, but a removable partial denture, it's always different, which makes it complex in its own way. And then we had diagnostic sciences, which had a very tough final, but because of the way the class was structured throughout the year, we had different modules with quizzes and team case assignments and things, so my grade was pretty high going into the final, which helped kind of offset the fact that the final was very difficult. I do feel like I learned a lot in that class, just like I said with the weekly quizzes and the case exercises. It forced you to really spend time with the material and learn as much as you could. And the next class was nutrition. So this was one of those half semester classes. It was the second half of the semester after the Principles of Restorative Dentistry finished up, and it was taught by the same professor that taught all of our behavioral science classes that we've taken every semester except this one. So it was half technical science, like micros, macros, how different foods are cariogenic or not, and that was taught by one of our faculty, and then the other half was taught by the behavioral science faculty, and it was more about patients with eating disorders or pregnant patients or communicating nutrition to parents of children. So more of like the psychological best practices and best ways to have like motivational interviewing with your patients, and just best communication tactics basically is a lot of what we've learned in those behavioral science classes. How to be respectful, how to get the best results, how to increase patients' self-efficacy and self-discrepancy to want to make these changes and understand why they're important. So very valuable class, and turned out okay for me, good grade, which is always a plus, but more important is what we learn. And then, like I said, I got an A+ in our SimLab class, which was really exciting, coming from first year, failing a practical, then doing okay in the rest, not amazing. It's really nice that second year I've been super successful in our SimLab. And then we had our physiology biomechanics of tooth movement. So it was kind of a second orthodontics class. We took the first one last semester, and I enjoyed it. I didn't like it nearly as much as the one last semester because it was just an hour and a half lecture every week, and that made it kind of boring and also didn't incentivize me to keep up with the material. Versus last semester, if you listen to the recap, we had the weekly assignments and everything that forced me to spend more time with the material. So again, like these are self-motivation things. Like if I sat down and studied it every week, I'm sure I would have learned more, but because we weren't required to, with how much else we had on our plate, like almost 30 credits, it's just not realistic that most students are going to then spend a bunch of time with the material. So it was a fine class. I did okay in it. Nothing too remarkable to say either way. And then we had our first pediatric dentistry class. So we have a few more of these as we go through the next semesters, all with the same professor. He is really great. He's so fun. He's so passionate. I really, really enjoy the lectures. I think they're engaging and well done, and they have a great mix of case examples and then just the straight facts, and then like the evidence-based, pulling up certain research to back everything up. So I really enjoy those lectures. I think they're well done, and I definitely learned a lot, and I find pediatrics to be very interesting. I would think that the general dentistry practice that I work in the future will be a family practice as well, that will see kids with less complex behavior or dental needs. Obviously, then they would go to a specialist, to a pediatric dentist, but I'm sure I will be working with kids, so I like to learn about it and try to be as well versed as I can. And then we had another perio class. We have 1 or 2 perio classes every semester of dental school, so this was periodontal therapy 2. I didn't do great in it, and I don't have too much to say about it. I don't think I learned as much as I usually do, and again, it wasn't a super great grade or a super poor grade. It was all just kind of okay. And then we had the last 2 pass-fail classes that I already talked about, the restorative dentistry and the practice management. The practice management is like one of the few business type classes we get. So we talked a little bit about insurance. We talked a little bit about like determining profitability of a practice. But like I said, with 30 credits, a pass-fail class, you're just doing the work to get the work done most of the time. So you're really not learning that much. Like I find that I've learned way more through my own engagement with different Facebook groups, with dental podcasts, with just following people that are knowledgeable about the business of dentistry and connecting with them than I did through that class. The class is fine, but again, I think you can learn a lot more, a lot quicker if you just do your own research. So that's pretty much everything I have about the classes. We will come back and talk a little bit about the SimLab clinical aspect of everything, and the clubs I was in, and then just some overall little semester life updates. So I also wanted to talk just a little bit about some things that were notable about this semester, you know? So overall, I think I've said this for both semesters of D2 that we've been working on crown preps that I just have found them to be a lot easier than our cavity preps. And I think a lot of it's like a mix. It's partially that they're being a little more lenient with the grading, and partially that my hand skills have improved after now like 2 years of drilling. But I also think that I must have a little bit better just natural ability for them or something. I think it's a mix of different things, but it's been really nice just going into practicals confident, not having to go after hours and practice as much, like knowing that I'm going to show up on practical day. I understand the requirements for this prep, and I'm going to do my best. I'm going to sit down, take my time, and try to make the best outcome that I can. And I didn't really see a point in going into practice after hours because I could try to do that and stress myself out or whatever, but it's not really going to change how my final result would be, because what we were practicing every single day in class is what was on the practical, versus first year you would have 5 different teeth in the mouth you'd do the certain type of prep on, and then only one of those would be on the practical. So if I'd only done something one time, I'm not going to go and take a practical on it, which is how it was first year, and that's why I had to go practice a bunch after hours. But the way this class was scheduled, you were practicing the tooth that would actually be tested on the practical a bunch of times, and that just made it a lot easier and smoother to just go right into taking the practical without having to do additional practice. And then there was dentures, the other aspect of time that we spent in the sim lab, and I mentioned it with the classwork, but dentures is tough. There is a lot of super specific, again, measurements, details, inclinations, situations where you would do this and not that, or of course you have to do this because of this. And it's just a lot to wrap your head around. And like I said with the partial dentures, so a patient that's only missing certain teeth, it's tough to know the best choice for their unique situation. There's so many elements of their mouth and their arch to consider. And also, on top of what maybe makes the most clinical sense, you're dealing with a person. You're not just dealing with a pretty type-it-out mouth that you want to restore. You're dealing with a whole human and their wants, their needs, their likes, their dislikes, their maybe history with prosthesis in the past that they didn't like or liked for certain reasons. So there's just a lot that goes into it, and I know whenever I do my first case in clinic, it is going to be a doozy, but hopefully if I get to do a couple pros cases in the clinic during dental school, I'll feel like I have a little bit more of a handle on it. And again, they're all so different from person to person, so it's not like by doing one, I'm going to feel like, oh, now I get it, I can do these for the rest of my life, because it's not really like that, because they're all so unique to each person. And I also wanted to talk in this episode about clubs. So I mentioned it in a lot of the intros of our episodes, just kind of what I'm up to and the different organizations I'm in. But I thought it would be good to summarize some of the fun things I got to do through student orgs this year. So I was elected in February of this semester to be president of ASDA, the chapter at our school at Michigan, and I'm so excited about that. ASDA's definitely been one of the highlights of this semester. We've had so many lunch and learns. We've been very busy with different speakers and companies that want to come engage with our students, and we have different lunch and learns or dinner and learns or socials, and it's just been a blast. And then we're working really hard to have more events that are just like for our members or maybe like internally put on. That way it can get a little break from like the sponsored activities as well, because I know sometimes that can be a little overwhelming on students when there's so many different people coming in and trying to pitch their something to you. It can make you feel like you're kind of missing something, and it might be stressful for people from time to time, I've heard. So we're trying to do a good mix of things, and I'm just really optimistic about the future of how ASDA is going to continue to grow and improve and add to people's experiences at our dental school. But I also was elected the social chair for American Association for Women Dentists. I was the VP all of the second year, and then recently transitioning into third year, I'm going to be the social chair, which is, I think, super fitting for me. It's exactly what I was hoping to do, and I'm really happy to be elected to that role. So I'll be running our chapter Instagram, and as you all know, me and my social media, very fun for me. But I'm also going to be dealing with a lot of the membership, so our mentor-mentee program between the first years and then the upperclassmen, as well as planning different events for welcoming in the new D1s in the summer. We do like a Galentine's and a Friendsgiving and usually like a little Halloween event. Sometimes we do different like spring things. It just kind of depends on the budget and how available everyone is, but basically just helping people find friends and connections and support in dental school through the other women in our school that are part of our chapter. And we also have assisting in AAWD, which I've found to be really helpful. So we have a Slack page where we can communicate, and one of those channels is for assisting. So if you have a free time and you want to be up in clinic, you can post that you're available, or third and fourth years that are looking for assistance for certain procedures can post and try to find help in there. So I think it's a good two-way street that we can get to meet new people and see new procedures, and then third and fourth years also get assistance out of it. So it's been a really fun time, and I feel like I know more people walking around the school and feel just a little more at home because I am involved in these clubs. And then I guess lastly, the one that's most notable as well of all of these is also Christian Dental Association. So as a Bible study leader, me and another D3, so the year ahead of me, were the leaders all of my second year, her third year. And going forward, we have 3 first years joining me, so they'll be second years, I'll be third years. I know it's a weird time with the transition of school years. Sorry if that gets confusing, but they're the year below me. And they're going to be helping me out with planning and leading Bible studies this coming year. So I'm really looking forward to that. I feel very blessed to have more people to help support and lead our organization and our community around the dental school to just bring light to people in a time when school can just be so stressful sometimes. I think it would be really hard for me to get through dental school without this group of students and without the reminder of having the proper perspective of life and of school and of service and everything. And that kind of transitions nicely into the last thing I wanted to talk about before we get into my assumptions for D3 year, which I always think is fun just to see if things did or did not come true. But the last little update I wanted to do is like how I'm doing, just like, how are you, Haley, kind of a question. So I'm doing really, really well, and that's so nice to say. I don't know how like open I was in the podcast intros when I first started dental school. I think I've always been really transparent with you, all the listeners, but first semester of dental school, like that first summer, was really hard. It was a mix of things, of course, with COVID and living at home and school online and just like everything being crazy. But I'm in like such a great place now. I absolutely love the house I live in and my roommates. I live with one of my classmates and then 2 girls in dental school the year ahead of me. And it's just such a great environment. We're very like positive living situation, and it's really nice to have different places to spread out. Like my first year I lived in a tiny apartment with a roommate, and now I'm in a house. So there's like a basement, a big living room, a kitchen, and then my own bedroom. So there's a lot of places to spread out and spend time studying in different environments. And of course you can leave the house now that everything is open and just like life is a lot more normal now. And it just is very hopeful and optimistic for me that the rest of dental school can continue on a positive pathway. And I'm really looking forward to seeing how things play out over the next 2 years as I continue to grow as a person and learn more and just experience new things, because dental school is so much to take in all the time. All the things you're learning, all the things you're doing, all the experience I'm having with these clubs and extracurriculars, but then also like all the life, your personal life, your family, everything that's going on outside of dental school too. A lot can happen in 2 years, so I'm excited to see how everyone develops, myself, my classmates, and I'm really optimistic going into my third year, which I think is a great thing. And I also wanted to share, like I said, a few predictions for next year. So I'm not going to tell you what I predicted about D2 year and whether or not they came true. I'm going to send you over to YouTube to watch that video. You can subscribe over there so you don't miss when it gets posted. But my expectations, predictions for D3 year, they give 5 every year, just so we have some context here. There'll be 5 things. So first is it will take 2 months for me to start to feel like I know what's going on with the flow of clinic. The second is it will be a struggle to meet the requirements each semester. I feel like if you're in dental school, you know what I'm talking about. The third is we will be able to stay in our house at school for another year. Basically, we have to re-sign the lease in October, which would be for my 4th year, even though it's only the start of my 3rd year at that point. So we have to find 2 new girls to move in to take the rooms of my 4th year roommates that will then be graduating when I start my 4th year. So I'm really hoping we can stay in that house because I love it and I think it's a really great deal and a really great space for dental students. The 4th thing is that I will struggle being able to make my YouTube content just because I can't film anything with patients, obviously. And a lot of what I do in videos now is like showing what I'm doing in SimLab. So I think it'll just be a very different dynamic. And I think I'll have a hard time feeling inspired editing clips of just me talking and describing what I did. So I think I might have like a shift of my content style or something, and it might be difficult for me. So we'll see. And then the last thing is I feel like I will have a lot more free time by fall semester because then at that point we're only going to have 1 day of classes a week and the rest will be patient care. So I'm interested to see if any of those things come true, and I want to thank you all again for listening to this episode, listening to any episodes that you do. I appreciate your continued support, and I'm wishing you all a great spring and summertime. If you're in school, I hope your semester finishes up well, and I'm looking forward to another great year and continuing this podcast.